As the new president of the Mercy Foundation, I am amazed to see the support generated for last year's Spirit of Mercy campaign. Our Mercy family and our community raised more than $1.1 million to support our mission here at Mercy, as well as within our community. Your philanthropic donations to the Spirit of Mercy campaign help fill a financial gap to advance many projects and equipment needs within our organization and our community. Over the years, your donations to the Mercy Foundation have helped fund a number of projects and programs here at Mercy Medical Center.
Donations to Mercy Hospice serve many different purposes for our patients and our staff. We utilize those funds to help support patients who don't have insurance or are unable to meet the financial requirements for their stay during their care here. We also use those funds for larger projects to purchase equipment, such as new hospital beds.
The beds were old that were here, and as a nurse, I knew how much work it was for the staff. And I thought if they could have better beds, that would be so helpful.
And just these beds are such that before you would have to move a patient out of the bed to weigh them, and they have to weigh them regularly so they can show how the patient's progressing. These beds, they don't have to move the patient, so it's much less interruption for the patient, and of course physically much easier for the staff to handle. It's just much less intrusive and much more positive all the way around.
A lot of our budget comes from donations and fundraisers, and those allow us to purchase supplies for patients in those departments. We wouldn't be having siblings or patients smile down the hallways, and because we do get that funding, we are able to do that, and parents and patients are able to have a great stay.
The new unit has huge windows with miraculous views of downtown that bring in enormous amount of light that help people just to feel human, like they're not in a hospital and they're in a home environment. It's amazing to see the impact that just giving someone more space and a little more control over their environment has done for their healing.
Many times our patients are unable to communicate effectively with us, and they try to write us notes or have other ways of communicating. So what we're going to do is use these Kindle Fires. They can type their needs, type a sentence to us, maybe have some pictures available for them if they're unable to communicate that way as well. And then staff will be able to see their needs, meet their needs. This will in the end decrease staff stress for the patient, and increase patient satisfaction as well.
We asked to get a blanket warmer for our patients because previously we had to go all the way to labor and delivery to get blankets if patients needed a warm blanket. And so since a lot of our patients are there for long periods of time or have trauma or something, it's always nice to give them a nice warm blanket when they need. And we've also gotten 5 iPads for our patients to use, since some patients, don't have access to internet or a computer of their own, so they can use that while they're here.
Last year, the overall support from not only our staff, but our community as well, helped us to hit a record-breaking year, raising more than $1.1 million. This year, Dr. Michael Frazier and I are privileged to serve as co-chairs of this campaign. We recognize the commitment our Mercy family made last year with a record-breaking year for donations. Let's break a participation record. As co-chairs, our challenge to you is to increase participation from 31% to 40%. Join Dr. Frazier, myself, and so many others, and make a gift of any amount to this year's campaign. No matter the size of your gift, you can make a difference.
We've been able to design a facility that's really the clinic of the future, to be able to provide care to women in a really new and unique way. Any contributions, whether it's a very small contribution to the large contributions, to make sure that we can fill out the center and do what we need to do right from the time that the doors open. It's just been really exceptional to see the support that we've been able to get.
The William Seaman Fund is something that we utilize almost daily, and it's a fund that's been donated to through employees, community resources. It was started by a patient's family member who had gone through the cancer journey, and we would really encourage people to give to this fund because it is something that directly affects our cancer patients every single day, and people appreciate it so much, and it just makes that cancer journey so much easier for people.
The Sisters of Mercy were clearly individuals who cared for one another, and the Employee Relief Fund is a wonderful extension of that. It is our collective organization that comes together. So when people, for example, have an unanticipated death or a very serious illness and they're trying to get to their loved one, they can contact our office, and we're able to help them fund a plane ticket, for example. So it's a wonderful way in which people support one another, and that's part of what makes the Mercy family so wonderful.
We are very, very grateful because if the funds were not there, there isn't a line budget item that just says, for purchasing car seats. So these car seats really provide not just a financial alleviation for these families, but really hope that their child gets to go home. And I think all of that together sends the message that we support you in being parents. We recognize that this is a huge step for you, and we want to do all that we can to help celebrate that with you.
We purchased the simulation doll so that we could run practice drills and do training and education for our staff. So we used the doll to simulate different things that they could come up with when they were actually working in the NICU. And the doll will cry, the nurses can start IVs in it, they can start umbilical lines on them.
This quarter, the Mom Baby Nursery and us here in the NICU designed a drill simulation utilizing this doll to better prepare both units to work together as a team in the case of an emergency in our Well Baby Nursery when an infant suddenly presents them as no longer well.
The doll is very pricey and it's not in our budget, and so being able to get the funds from the foundation allows us to use our actual budget on different things.
As president of Mercy Medical Center, I can't tell you how proud I am to see the generosity of our Mercy family. Beyond the work they do each and every day to provide a remarkable Mercy experience, members of our Mercy family continue to contribute at high levels to the annual Spirit of Mercy campaign. As we approach this year's campaign, we'd ask that you also consider supporting one of these charities, United Way, a variety of children's charity, as together we work to improve the quality of life in our community.
Gifts to the Mercy Foundation through the Spirit of Mercy campaign can be made to any of the hundreds of funding areas within our organization. Your pledge will have a list of areas our colleagues give to most often. However, if there's another area that you feel compelled to support, we encourage you to write the name of that in the other section on your pledge form. Talk with your team captain or your department managers to see if there are funding areas within your own department. Please join me and so many of our colleagues in making a gift to the Spirit of Mercy campaign. Your gift, no matter how small or large, can make a lasting impact.
It's really important for staff and community members to realize their impact that they can have on foundation dollars.
We truly appreciate all the donations that are given, no matter how small or how large. Every penny helps and every penny counts.
The reason God gives us resources is not so we can selfishly consume them, but how can we use them to serve the Lord and serve our fellow man?
If you have opportunity, whether it's small or large, please give.
On behalf of our entire Mercy family, and most importantly on behalf of the people that we're privileged to serve, thank you for your past generosity to the annual Spirit of Mercy campaign. We are so proud of our Mercy colleagues. They work so hard each and every day to provide a remarkable Mercy experience to everyone we're privileged to serve. And they go even further beyond that by supporting our annual Spirit of Mercy campaign.